So, Assalamu alaikum, everyone. My name is Dr. Nasrum Iqbal, and I'm board certified in internal medicine, lifestyle medicine, obesity medicine, and fellowship trained in integrative medicine. So, this is one of my passion, to present this topic, when we start any conference, because this is related to physicians' health. So, before I will start, I would like to thank Professor Nadeem Hafiz Butt, the AMC alumni, and the faculty of AMC by giving me this opportunity to present today's topic in CPC. Before I would like to discuss physicians' health and their role in their patients' health, I would like to give a brief overview of lifestyle medicine. And so basically, lifestyle medicine uses evidence-based lifestyle therapeutic approaches, prevent and treat, and sometimes reverse lifestyle-related chronic disease. So the word reverse lifestyle related chronic disease is important because it is not only to prevent or treat, but it also reverses certain medical problems like diabetes or obesity or coronary artery disease. Lifestyle medicine is the application of medical, behavioral, motivational, and environmental principles to the management of lifestyle-related health problems in a clinical setting. Physicians act as both medical expert and a coach. Regarding a brief history of lifestyle medicine, this is not something new. It has been there for a long time. As you know, Hippocrates said once, let your food be your medicine and medicine be your food. He was an advocate of teaching a healthful diet and being physically active to avoid and combat disease. Same thing, Thomas Edison, the doctor of future, will give no medicine. And another guy, Nathan Critical Longevity Center, it was a residential healthcare center that used nutrition, exercise, and education to treat and reverse heart disease. So most of these programs regarding lifestyle medicine, they were done because to prevent coronary artery disease. Can you please mute the mic? Actually, somebody has turned on the mic. Just tell to please mute it. Some other pioneers like John McDowell program, Dr. Dean Ornish Preventive Medicine Research Center. It is currently in California. And the purpose of his program is to introduce lifestyle heart trial, which showed regression of cardiac stenosis at 1 year and continued improvement at 5 years through a low-fat vegetarian diet, stress management, exercise, smoking cessation in a small group of patients. Basically, he's a big fan of a plant-based diet. He does not allow any kind of animal product in his treatment plan. Other pioneers, Dr. Esselstyn, and even WHO reported diet, nutrition, and prevention of chronic disease, and addressed how poor diet quality and excess calories are related to the rise of chronic disease. So it was nothing new, actually, but we are just trying to give more importance to lifestyle medicine and lifestyle modifications. So this is a word which you all use multiple times, like whenever a patient comes to you, you all say lifestyle modification kare ji aap. Lekin in reality, you all need to know what are those lifestyle modifications which are important for a patient. There are 6 major components of lifestyle medicine. And I would call it like a core measures, or you can say core components. Number 1 is nutrition. And for nutrition, you need to remember this word whole food plant-based diet, which means that just like an apple which comes from tree, you wash it and you eat it like that. So this is what whole food plant-based diet means. Then regular physical activity, adequate sleep, stress management, avoidance of risky substance use of other non-drug modalities that promote health and prevent disease. Regarding advocacy for lifestyle change, I would stress this word, blue zone projects. There are some blue zones areas in the world where there is a longevity. Most prominent areas are like Okinawa. There are some areas in Greek island. And the importance of this blue zone areas is like people over there, they live longer. So what they found out, they have something common among them. अहमद साहब, can you please ये mute कर दें mic को, वो आवाज echo हो रही है. So the purpose of this blue zone is like they people over there, they live longer, and there are certain common things like they all move, they eat healthy diet, they sleep on time, they are emotionally connected, they are spiritual. So these are certain common factors among those patients. And this based on this, there are certain foundations like Robert Wood Johnson Foundation. They are creating a culture of health in collaboration with community leaders and medical providers. And same thing with Dr. Dean Ornish in California. So they have started a project in Loma Linda, where they converted the whole small town into this blue zone where people sleep at 9 and they don't eat meat. They don't have any coffee over there. So basically, it's like a very natural lifestyle. 78% of your office visit, they are lifestyle-related chronic medical problems. In a primary care office, like general physicians, when we see in the office, 78%. So just look at these diseases: obesity, metabolic syndrome, hypertension, cardiovascular disease, dyslipidemia, arthritis, diabetes, osteoporosis. And these are just few of them. Even there are certain type of cancers, I would relate it to lifestyle as well. So lifestyle is the main problem, you know. Now, just focus on this slide. 80% of premature deaths are due to these three major factors. Just look at these: tobacco use, poor diet, lack of physical activity. So 80% of deaths, they are connected to these three major risk factors. And what are these three risk factors? They are basically lifestyle factors. Scientific data, there is scientific data support, just a minute. Scientific data support physicians who practice healthy lifestyle are more likely to counseling and well care to their patient. Are not consistently practicing healthy behaviors. In a survey done in 2012, 50% of physicians were obese. And there was another survey done in Canada, 36% of physicians, they did not meet physical activity guidelines. There was another survey done in California, and it stressed out like 53% physicians, they had severe to moderate stress, 35% with no or occasional exercise, 34% used to sleep 6 hours or less, 27% never or occasionally ate breakfast, 13% used sedatives and tranquilizer, which means that they were under stress and they were not having good sleep, and that's why they need to use these things. 7% depressed. I think this number is very low because only 41% physicians, they answered the survey questions. 60% did not. And if I would say today, this number would be around 30 to 35%. And 4% used to use marijuana. This is like undisclosed, but marijuana was like reported, but you can see like with the stress, you know, physicians, they use substance. Physicians' personal health impacts patient care. How? Doctors who exercise are more likely to counsel patients on exercise than those who don't. Non-smoking physicians are more likely to emphasize the risk of smoking. More likely to talk about obesity if they perceive that their weight is more than patient weight. If physicians eat less fat, they counsel more on cholesterol. If they eat 5 fruits and vegetables per day, they counsel more on nutrition. If consume a vegetarian diet, are more likely to counsel on weight loss and nutrition. So basically, as we all know that we need to eat rainbow, like small servings of fruits, small servings of vegetables. I'm not saying like we need to portion control fruits and vegetables, but we need to have rainbow in our diet. And so what are those strategies which we can introduce in our offices, to have a healthy lifestyle? Assure providers have an access to physical activity opportunities, promote healthy meals in and outside the office. So like, I know you all love to eat samosas and cakes and parties and everything, and sodas. So try to cut down these things and substitute it with healthy food. So if you don't practice, so how can you preach to your patients? And obviously it is important for your health as well, because if you do a survey currently, and you will find out every second or third physician has heart problems if they are 40 plus. Install in standing workstation, use technology to assist in tracking activities and to engage colleagues in health challenges and competitions, breaks for healthy activities, and involve in local community changes that support healthy living. What are your overconsumed food? I'm not going in detail of every a dietary plan, but I'm just going to let you know where is the problem. The overconsumed foods are, as all of you know, added sugars, high fructose corn syrup, which is present in almost every single diet, cholesterol, animal food, saturated fat, which obviously meat, dairy products, high sodium content in commercial food like snacks and processed food, trans fats in bakery products like cookies, cakes, and cakes are very popular in Pakistan and all over the world. I'm not saying Pakistan only, it's all over the world, the same trend. Processed grains, white bread, rice, and white pasta. There are certain shortfall nutrients and they are underconsumed. And what are those nutrients actually? Calcium, fiber. Fiber is very important, and we don't pay attention to this kind of nutrient. Potassium, vitamin A, vitamin C, vitamin D, vitamin E, and vitamin K. These are certain nutrients which are we are not consuming properly from our diet. And that is the reason why physicians, they are recommending vitamins, to their patients or to take by themselves. But if you eat healthy diet, your healthy diet will cover these things. When you have fruits, nuts, vegetables in your diet on a regular basis. So what are those nutrient-dense foods? Foods which have most shortfall nutrients with the least overconsumed nutrients per calorie. And these are obviously vegetables, herbs and spices, fruits, legumes, whole grains, nuts, and seeds. And to be honest, currently there's like 4th year and final year students are there. Every one of you need to know what lifestyle medicine is and what are the core measures and core components of lifestyle. Every physician or every student or every resident should know these things. There's one slide I'm showing right here, epigenetics. I don't know how many of you know about epigenetics. We blame everything to our DNA or to genetics, like patients who have heart disease, we say, oh, the family mein run karti hai, to isliye isko ho gaya, cancer hai. But always remember, it's not only your DNA. You do by yourself. You trigger certain genes, by your bad lifestyle, by your bad habits, which trigger those areas of DNA, which cause cancers, which can cause diabetes or obesity. And how does it do it? Actually, DNA methylation, microRNA, histone acetylation, growing number of other molecular changes. Same thing like longevity. So with your lifestyle, you increase the size of telomere, in your DNA, and which, and same thing, like you reduce the size. So it all depends on how you are spending your day and night, what you're eating, how much active you are. So all these things play important role, and they change your genetic makeup through epigenetics. So simple example I give you here right now is a couple who is going to conceive. So we always recommend that both father and mother needs to they need to uh, be like follow the lifestyle pattern. They need to control their weight. If they are obese, they need to lose weight before they are getting like conception, because both father and, I'm not saying only mother, even father, if he's obese, it's going to transfer, like in the patient will get like in their second or third decade, obesity and diabetes. So this is how epigenetics work. I will skip certain slides faster, So regarding whole food plant-based diet, there's some like what it does. It changes epigenetics. Uh, it lowers the risk of chronic diseases, normalize angiogenesis, and reduces some comorbid disease like cancer, heart disease. And what are those, vegetables, especially cruciferous vegetables like your gobi and broccoli, these kind of vegetables, onion, mushroom, every vegetable is important. If you ask me, all kind of salad, kale salad, radish, and cucumbers, everything is important, because your body needs fiber, and these nutrients, they feed your microbiome in the gut, and they play a very important role. I will show you the slide next. So improves insulin sensitivity independent of weight loss. And there's one more thing, what it does, it increases leptin level, which suppresses your appetite during the daytime. And what it does actually, the whole food plant-based diet, it improves glycemic control and optimizes the microbiome in the production of small chain fatty acids. And how it does actually, whatever you're eating, it goes to your gut, and this fiber, we think it gives bulk to your stool, but there are some other benefits from this fiber as well. And what it does actually, it is a diet of your microbiome. And what microbiome does, it produces small chain fatty acids in the form of butyrate, which enhances insulin sensitivity, enhances mineral absorption, is good for the gut lining, decreases cholesterol and triglycerides, decreases glycolysis in the liver, and improves satiety, reduces pain associated with peripheral neuropathy. Now, the second component, I already told you about the nutrition part, which I don't tell you like what to eat, what not, but just a broad categorization of how you need to think when you're eating, actually, when you're eating, how you can plan your diet. Physical activity, it's a full topic, but I'm touching it. So physical activity is any movement of the body done through skeletal muscle contraction that causes the energy expenditure to be beyond its baseline. Higher health-related fitness, higher control and maintenance of healthy weight, and less risk of disabling medical condition, and less chronic disease rates than people who are inactive. And what is exercise? So purposeful physical activity that is organized, planned, and recurring, and that is done with the intent of improving or maintaining one or more components of one's health. This is what you call exercise. There are very clear guidelines. Every adult should have 150 minutes a week of moderate intensity physical activity. This is from American College of Sports Medicine, and or 75 minutes of vigorous intensity physical activity. If somebody likes to do HIIT, they don't need to do like a 1 hour or half an hour every day. They can be just do 20 minutes of HIIT and they're done. Any amount of exercise is better than none. So while you are working in your workplace and you have 5 minutes, 10 minutes, you can just go out and walk, you can take stairs, and try not to use elevators. Try not to park your car as far as you can. And if you want to lose weight, then you need to do more exercise, like 300 minutes of like moderate intensity, or 150 minutes of vigorous exercise if you want to lose weight. But the other part was not for weight loss. Strength training. Strength training is another very important type of training. Usually we think like it is meant for young people, but this is not true. We think like only young, adults needs to go to gym. Actually, it is us, like anyone who is 40 plus or 45 plus, they need to go to gym because we need to have muscle strength. And um, the strength training and resistance training protects us from obesity and diabetes actually. And there are multiple studies on this topic. And when you're doing this kind of activity, at least 2 to 3 times a day, you should do strength training. Because one of the thing we come across in older age is sarcopenia. And sarcopenia is like muscle mass. So a lot of times you see like someone is obese and big, but they don't have muscle mass. And that is bad. Stretching 10 minutes, 2 to 3 times a week, and um, whatever you like, some here, like in US, people love to do yoga and Tai Chi for 20 to 30 minutes a day as well. So whatever activity you want to do it. Any amount of exercise is better than none. So physical activity improves your sleep, improves brain executive function, helps depression. So look at this depression, currently one of the treatment for depression is physical activity and activity on regular basis. Quality of life improvement and physical functioning. Physical activity has enormous benefits. It's a very, very long list. I'm not going in detail of that. And it also reduces anxiety. Then the third component, I told you about the nutrition, I told you about the activity. Now the third component for everyone, for physicians, emotional health. It is another important thing. We think like only nutrition and exercise is important. No, emotional health is equally important. Very common in physicians these days, depression. So depression is associated with cardiac disease, strokes, cancer, and diabetes, and it's vice versa, like it's a bidirectional. And these problems or chronic diseases can lead to depression. Independent marker of mortality, negative perception of diseases and its complication. When somebody is depressed, no matter what you do for that patient, no matter what you do for yourself, you will not do it unless you treat the underlying depression, because you'll not be motivated to do anything if you're depressed. And coronary artery disease events and death events, they're higher in depressed patients because stress can lead to abnormal platelet adherence, endothelial dysfunction, lowered heart rate variability, worse adherence to lifestyle changes. Components of emotional health. What are those components of emotional health? How you can feel happy, or or physicians needs to improve their health. Connect with others like family, friends, get involved in activities, do whatever you like to do, music, exercise, dance, meditate, yoga, prayers, fun activities, hobbies, spiritual needs, focus on accomplishment from the past and what challenges you already have been overcome. And then celebrate success. This is a very important word. When somebody have success, please enjoy those moments, celebrate it. Don't take it negative, that he won and you're losing. Don't feel like that. So today he is having success, tomorrow you will have it. So enjoy these moments of life, and cherish your good time. Count blessings. Whatever you have it, feel good about it. So look other people like who doesn't have those things which you have it. So count your blessing every single day. When you come to your place, you need to be thankful what you have. Regularly practice kindness. Kindness with everyone, with your colleagues, with your friends, with your families, with your students, with your patients. You need to do that and make it a habit of forgiving others, because this is another important thing, because whatever you keep inside your body, your mind, you keep it, and this is a kind of toxin. So let it go, because if you don't let it go, you will not move forward. So you have so much stuff already in your basket, that you cannot afford to keep these things in your mind and in your heart. Simple. I'm going very quickly. Stress response. What stress does to your body? Increases your heart rate through stimulation of the brain, tense muscles, breathing, rapid breathing, endocrine, like it increases cortisol level. And then what cortisol does, it's an anti-insulin. Constant stress can lead to inflammation. And stress is not just like you're worrying about things. Stress is like even while you're working and you're seeing patients constantly, you are under stress. And GI effects like IBS, or you like it gives you like a, some people they don't eat properly, or some people they eat more actually during stress. Relaxation, what relaxation does to your body, when you relax, when you calm down, it decreases your heart rate, decreases blood pressure, decreases rate in breathing and muscle tension. So very simple. And there are different techniques to relax: meditation, mindfulness, prayers, Tai Chi, yoga. These are things, non-pharmacological stress management techniques, mindfulness exercises, meditation, um, relaxation, breathing, abdominal breathing, expressive and creative pursuits like dance, music, singing, massage, Tai Chi, volunteering for meaningful causes, spiritual and religious activities, and regular time in nature. For my Pakistani physicians or my patients, I always tell them, people who pray with proper concentration, that is your yoga actually, and that is your mindfulness and meditation. The best mindfulness is like when you're praying with proper concentration. So, because if I tell you to do yoga and do meditation, one day you will do it, other day you will not do it. So these are the things for those who pray on regularly. Our namaz is a perfect lifestyle. That's what I'm going to say. What is mindfulness? You all hear this word. What mindfulness mean actually? You all hear this word, and everybody should know that what mindfulness means. It is actually paying attention in the present moment without judgment. So basically, you need to live in the moment. If you're going to see your patient, make sure that you are going with your mind in the room actually. Don't distract yourself. Don't do multitasking. If somebody is telling you, if there's if another patient is not dying, you don't need to distract that visit actually. Go in the room, focus with your patient, and listen to that patient for 3 to 4 minutes, with concentration. Be mindfulness. If you're eating your food, be mindfulness, because it resets your mind. Multitasking is not good. Ultimately, it will lead to dementia in future actually. So mindfulness is very good for and you will enjoy your food. Let's say if you're mindful and you're eating food and you're not watching TV while having food and while talking, you will focus on food. You will enjoy every single bite of that food, and you will be eating the correct amount of food. So patients who are obese and those physicians who are overweight, they need to have mindfulness eating. So mindfulness is good actually for your brain, for your body. There is a 8 weeks course designed by Dr. John Kabat-Zinn in Boston, and he did it actually in 1970s. So it's nothing new. And this is basically an excellent course for those patients or those physicians who have anxiety problem. It helps anxiety, but the problem with this thing is, first you need to spend 8 weeks, and then 45 minutes a day. So I actually simplified it. There are certain different techniques, like 7-8, 4-7-8, like you breathe for 4 seconds, hold it for 7 seconds, and breathe out for 8 seconds. A very small thing to do twice a day. And basically this MBSR is a kind of body scanning. It's very like there's so many similarities with yoga and this course, so it's an 8 weeks course, but it definitely helps your brain. So what it does actually, 8 weeks of mindfulness training can lead to prefrontal cortex development, increases gray matter density in the prefrontal cortex area, and reduces gray matter in the amygdala area, which is an emotional area of brain. So, and it was proven by the functional MRIs. Brain, always remember one thing, brain is one of the organ of your body which grows with age. There's no other organ of your body which grows actually. It's only the brain, because whatever you're doing, whatever physical, mental activity you're doing, whatever physical activity you're doing, it creates new pathways in your brain, new neurons developing every day, So it doesn't mean like you stop using your brain. So the more you use your brain, it's good for you. So, just a quick picture of prefrontal cortex. Like, it is a very important area of your brain. it's like it's your empathy, your insight, emotional regulation, body regulation, moralities, intuition, fear modulation. They're all from prefrontal. And benefit, as I mentioned to you, it increases resilience, self-esteem, energy, enthusiasm, improves one's ability to cope and short and long-term stressful situation, and one's ability to relax. And the most important thing, inflammation. Inflammation. I'm using this word thrice, inflammation, because currently most of the medical problems are connected to inflammation, actually. Your relaxation, your stress reduction reduces inflammation. And it also helps in compassion and empathy for self, for others, tolerance and resilience. This word you always hear, among physicians: burnout and compassion fatigue, two different entities. Burnout is a lack of satisfaction with one's job, which may be due to hours, pay, or stress. And compassion fatigue is like post-traumatic stress disorder, but it's an acute distress or tension. And basically, when you are a helper and you are traumatized and preoccupied with suffering, which may lead to the helper having poor coping, poor self-care, or self-sacrifice tendency, which we all have it, like all the physicians, we do have this kind of problem. So self-care can help prevent burnout, enhance empathy, and improve attitudes among physicians. And for all my counterparts, all the Pakistani physicians, you need to take care of yourself before you have medical issues. Like young physicians, they need to always follow some good, start practicing from now. So I'm going to let you know in my few slides what kind of bad habits we have it. And the last line, which is the most important line of this slide: self-care is essential. Why? Before heart sends blood anywhere else, it sends blood to itself. So basically, if you don't take care of yourself, you cannot provide a better care to your patients. So first you, and then your patients. Current society, what is doing right now? Bad, whatever we are doing right now, it is bad for prefrontal cortex because we are doing multitasking, addiction to distraction, media, phones, watches, stress overdose, sleep deprivation, too little exercise, and no brain breaks or downtime. So these are the current trends of majority of the physicians. Just review these points which I mentioned. And how mindfulness helps your clinical encounters with the patient: focus and sustain your attention. Deepest brain state of clinical encounter. No distraction for peak performances. Stay curious, non-judgmental, and open-minded with your patients. Put a brake on distraction. The brain must exhibit effective inhibition. Take brain breaks. Better to stretch or walk as a break. Be creative and be strategic. Like what is important, what is priority. You need to prioritize your stuff. Now, sleep. When somebody asks me what one thing we can fix, to improve our lifestyle, I always tell them to please fix your sleep. Ideally, 6 to like an average in US, the average time is like 6 hours, 57 minutes. 20% sleep less than 6 hours. 60 million US adults have frequent difficulty sleeping, actually. So you can imagine what is going on in Pakistan, like what you could imagine. 7 to 8 hours per day sleep is required, and deficiency impairs functional performance. This slide I would like to show you. Everybody of you should know how sleep helps your body hormones and your body functioning. So on your left side, like this, melatonin is a sleep hormone. This is one of the hormones we never paid attention when we were in med school, because we read the whole endocrinology, and regarding melatonin, we just know that it comes from pineal gland. That's it. But in reality, this is the queen of night hormones. How does it help? Somebody's mic is on, actually. Can they shut up the mic, actually? We have only two. Thank you so much. So, so basically, your melatonin controls your body temperature at nighttime. So if you look at the graph on the right side, when your melatonin goes up, your core body temperature comes down. and your cortisol level remains flat. So just imagine if your melatonin level is not going up the way it should be, then your cortisol, your insulin, your adrenaline, and noradrenaline level, they will be disturbed actually. And this is one of the reasons where you say like, oh, my blood sugar is uncontrolled, I do everything, I watch my diet, but you're not sleeping on time. And then just imagine like physician lifestyle in Pakistan. You guys are sleeping at 2 in the morning. You are playing with the nature. The whole body is under the control of day and night, actually. Your body needs light, your body needs darkness. So if you don't follow this pattern, it is very, very injurious to your health, actually. So, um, and this is one of my favorite place, where I counsel my patients, like improve this. I always ask about sleep with my patient. And what sleep does to your metabolism? Just look at this long list. Lowers cortisol and glucose level, greater insulin sensitivity, higher daytime leptin, which cause reduced food-seeking behavior, lower sympathetic tone and blood pressure, greater nighttime peripheral perfusion, increased stamina and faster cardiovascular recovery time, enhanced learning and memory, and faster cognitive processing, DNA repair, and neuron remodeling. You know this part. Like when somebody sleeps well, most of the repair happens in at nighttime when you sleep. And when you are in a deep sleep, there's a new study came in. Deep sleep is important for your brain function, and deep sleep, people who do not go in deep sleep, they are prone to get dementia, premature dementia, I would say. And obviously, aging. You age fast when your sleep is not good. And recommendation for sleep is you need to sleep on time, regular time, not just 7-8 hours. Your regular sleep timing is important. And a bed should be used for sleep and sex. And if you have trouble sleeping, you can take shower, bath, make your sleeping environment more comfortable. If it's cold, wear socks. If it is hot, you can use some like a cooling effect, and don't put alarm clock in your out of sight if you have sleeping disturbances, and increase daytime exposure to light. So everything is important. Daytime light is important because what it does, it brings your melatonin level to zero. When you expose your eyes to a daylight for 20 minutes, your melatonin level comes down and your brain, gets activated. And this is good for your mind and your other hormones as well, because when melatonin goes down, your cortisol level goes up and your insulin sensitivity, everything improves. Increase daytime activity, and some dietary recommendations for sleep. Simple rule: low carb diet, low sodium diet at nighttime, and no caffeine after 4 p.m. So I know you love to have tea and coffee. Everyone loves to have that, but it is not recommended to have coffee after 4 p.m. or 3 p.m. And stress reduction, most of us, what we do, start settling down 1 hour before going to bed. Include active relaxation. Do something good, actually. Listen to music, read some books, and stop working or doing stimulating activity 90 minutes before going to bed. And mitigate nighttime worrying, planning, or ruminating, actually. And don't use cell phones, because we are all in the habit of using cell phones at nighttime. And stop smoking if you do. Why? Because there's a long list of medical issues, connecting with smoking, like cardiovascular, lung cancer, diabetes, arthritis. You just name it. You just think about it. Smoking causes those things, actually. Impair immune function, reduce quality of life, problem with reproduction in men and women, poorer and longer wound healing, TB, ectopic pregnancy, and there's a long list, erectile dysfunction, macular degeneration, and risk of. And above all, if you smoke, you will not preach your patient, So when you deal with the patient who smokes, the number one thing you do is to advise the patient to stop smoking. So with this, I would just conclude that this is one of a talk or a topic which every one of you should know, because it is very, very simple to tell patients or change your lifestyle or it's a very simple word, lifestyle modification. But did you see that? I spent 45 minutes just talking about that. And I could even talk for 2 hours, discussing all these things. So this is what all the physicians should follow. Sleep, is the most important for you guys, because I don't want you to get dementia or heart disease, because both of these major issues are connected to your sleep, actually, even cancers, even your longevity, actually. You will look much younger, if you sleep well and sleep on time. So with this, I would just say thank you so much again to um, give me this opportunity by AIMC alumni, Professor Nadeem Hafiz Butt, the college faculty, and the students, who are listening to it. And I wish, if you take a couple of, strong messages from my today's talk. Thank you so much. And I will be happy to take any questions if anyone has questions.